Now, junior doctors are going on an unprecedented all-out strike next Tuesday and Wednesday in protest at the government's decision to impose a controversial new contract. That decision was taken by the Health Secretary, Jeremy Hunt, after negotiations with the British Medical Association failed to come up with a compromise both sides could back. This is Jeremy Hunt announcing his decision in a statement to the Commons back in February.
Progress has been made on almost 100 different points of discussion, with agreements secured with the BMA on approximately 90% of them. Sadly, despite this progress and willingness from the government to be flexible on the crucial issue of Saturday pay, Sir David wrote to me yesterday advising that a negotiated solution is not realistically possible.
That was the Health Secretary there on his decision to impose a new contract on junior doctors after the BMA rejected what the government said was its best and final offer. We're now joined by a junior doctor and a campaigner, Dagan Lonsdale. Welcome to the programme. As you move to an all-out strike, you must be concerned that the public support you have enjoyed so far could now atrophy.
Well, I think the first thing to say, as we're a few days ahead of what is unprecedented action in the NHS, it is a real shame that the government refuse continually to do the one thing that would stop strikes, the one thing in their power that would stop strikes, and that is to engage in a conversation with the people who work on the shop floor and look after patients.
Well, the government says it's had 75 meetings with you and made 73 government concessions.
Well, the government...
Why would one more meeting make a difference?
Well, the government love to spin that they are the ones making all the concessions, and of course the BMA have done that as well. But the fact is a contract is not finished until the contract is finished. And it is not good enough to simply throw your hands up in the air and say it's going to be imposed. You don't need to just listen to doctors about that. The Vice President of the Patients Association today has said that there are legitimate safety concerns over the proposed contract, and that to enforce it risks real danger to patients and would in fact be negligent. So, you know, there are lots of people, the heads of all of the Royal Colleges, the junior doctors themselves, both grassroots and BMA, all saying that it's time to talk with the Health Secretary, and that until we can have a negotiated settlement, we won't have an NHS that is safe and sustainable for our patients.
Are patients going to be at risk next week?
I think the first thing that we need to be clear about is exactly what's being proposed, because the government are trying to spin that junior doctors are simply leaving patients in the lurch. That is untrue.
So that's why I'm asking you. Tell us the truth.
So we're having 9 hours where care will be delivered by the most experienced doctors in the hospital. That's consultants and other non-junior doctor grade doctors. And to suggest that those professionals are unable to look after patients for 9 hours is frankly insulting to them. And the other
so are they at risk or not?
The fact of the matter is that trusts have had 6 weeks to prepare for this strike action, and so they have had plenty of time to mitigate that risk.
So they won't be at risk?
Well, my view is that with the notice that has been given to trusts, and the fact that trusts have, in my case, hundreds of consultants at their call, they have plenty of time to have made plans to make things safe. But the fact of the matter remains, we don't want to have to cancel patient appointments. We don't want operations to be cancelled. We want to be looking after patients.
What separates you now? Is it all down now just to Saturday pay?
I think, again, this is just an example of government spinning and government rhetoric. There are legitimate safety concerns about this contract, primarily around the fact that 7-day NHS was scribbled on the back of an envelope in the lead up to the last election without any funding or any planning.
But if the government was more generous, made a further concession on Saturday pay, would that pretty much do it?
Again, I think this narrative that doctors are just interested in money is not the truth.
No, it's not it's a simple question. If the government was more generous on Saturday pay, would that bring the dispute to an end?
No, absolutely not, because junior doctors have had a 15% real terms pay cut in the past 5 years. We've had our pension attacked twice. This is not about money. This is about a safe working set of conditions.
So what does the government have to do? What is the further concessions the government has to do to bring the dispute to an end?
Well, in my view, the first thing we need to do is have a full and frank discussion about what 7-day NHS means, what we can afford, and what can be safely staffed.
Well, why haven't you had that in the 75 meetings you've already had?
That's a question for government, and I noticed that they haven't put anyone up to debate the matter here. And yet again, we see that a junior doctor is prepared to come and stand and defend the arguments that junior doctors have been putting forward, but government aren't prepared to come and have a debate. And the reason is they know if they're debated on facts over 7-day NHS, the lack of staff, the lack of funding, they'll be found wanting, because this is all a pledge to just try and win votes in the election.
So what you would need to end this is the government to say we're going to deploy more staff and we're going to deploy more funding.
I think those two are key issues if we want to have a fully functioning 7-day NHS with elective services across the weekend. I don't think that's an unreasonable thing to say.
You and I both know that you may well be right, by the way, in saying that's what needs to be done. That's not the issue for me. But you and I both know that the government is not going to do that. So where does this go?
Well, the first thing that needs to happen is that doctors and government need to talk. And that is so simple that it frustrates me.
But you have been talking and we've ended up with a strike.
You're absolutely right. And there needs to be honest discussions. And the government need to be honest about what they can afford. And, you know, it is not my job to come up with the policy that is funded, that is staffed. It is my job to make sure that patients are safe in the long term of the NHS. And that is what junior doctors have been fighting for.
Where's this going to go, Ian?
I think it's been extremely embarrassing and very damaging for the government, but I think it's now crossing that line where, as you move to all-out action, I think you run a real risk of losing the public support and testing the public's patience, really. And also, I think the idea that it was yet again a plea for more money and more resources. I mean, the country still is running a £70 billion, 74 we now know, £1 billion deficit at the top of the cycle, with the economy not looking too hot. I don't think there is going to be that much more money to go around. I agree. They're not sitting on a lot of money pretending not to give it to you.
Maybe the government, Anushka, should never have gone down this 7-day-a-week health service in the first place if it hasn't got the extra resources.
Well, one of the big things ahead of the election was they said they were going to sign up to Simon Stevens' call for more money in the NHS, but never quite explained where the money was actually going to come from. Yeah. I think for the public, with all of this, one of the things that's complicated is they don't understand what's going on in the contract. No. They don't really know what this is about. So on the one hand, bad news for Jeremy Hunt to get into such a big fight with the nation's doctors. On the other hand, clearly a bit of a risk because most people don't get paid as much as doctors.
We'll have to leave it there. We thank you for coming on. We'll keep an eye on this. It's grateful for, because you're right, you have appeared. We'd like some others.